Good evening, ladies and gentlemen. We are honored that you have joined us here tonight. My name is Mike McGuire, and I want to say thank you for allowing me the absolute honor to work with you as state senator representing the Golden Gate Bridge to the Oregon border. We want to say thank you for joining us this evening for this critical town hall on the coronavirus, the Delta variant, and kids returning to our schools. We have over 3,000 folks who are now tuning into this critical town hall. And tonight we're coming together. We're coming together to be able to discuss the surge of the Delta variant in our communities. And we're going to have a special focus on our kids who are heading back to school after 12 months of mostly being remote. We're going to be talking about the facts here this evening, and we're going to be dispelling some of the myths that have surrounded this public health crisis over these past 18 months. As you know, there has been an alarming increase in COVID-19 cases across the nation and right here at home in California. And this uptick, it's a consequence of the Delta variant. And it's why we wanted to be able to come back together, as we've done over 15 times during this pandemic, to have this important community conversation. Now, the Delta variant, it is the predominant strain of COVID-19 in the United States. It's causing more infections and spreading more quickly than any other of the previous strains of the virus. And the number of Californians hospitalized with a confirmed case of the coronavirus, that number has increased by 64% in the last 2 weeks alone. And as of tonight, approximately 64% of all Californians have now received at least one dose of the vaccine. And looking ahead, and I just want to be candid, as I always am, the latest surge that we're seeing with the coronavirus, this latest surge, it's completely avoidable. It's a surge among mostly the unvaccinated. The best way out of this pandemic, and I know some may not agree with me, but the best way out of this pandemic is by getting the shot. Vaccines are safe, they're abundant here in the Golden State, and they're always going to be free. And it's the single most important thing that you can do to protect yourself, to protect your family, to protect your community, and to keep our healthcare systems running smoothly. And I want to talk with you about a real concern that we have. There's a growing concern in rural regions in Northern California. The counties of Lake and Humboldt and Del Norte, they're now ranked in the top 4 counties in the state for new virus cases. And this surge, it's significant and it's turning out to be deadly. In fact, the state has now sent 2 waves of additional medical staff into Del Norte County after the county and Sutter Coast Hospital, the largest hospital in the county of Del Norte, requested assistance. The first set of additional staffing has already arrived, and that additional staffing is assisting with expanded treatment. They have propped up a new mobile testing service, and they've expanded the number of vaccine sites. The second request for testing includes respiratory therapists and nurses, ICU nurses, and X-ray technicians. Over 40 ventilators now. Over 40 ventilators have also been ordered up by Del Norte County from the state of California. Now, I assure you, we are in constant communication. One more time, we are in constant communication with all the counties we represent and will deliver for any hospital, any health clinic, or any public health department who is in need. All right, let's get right into our town hall. Tonight, we have the latest and most accurate information on the Delta variant, vaccines, and how this surge is impacting our kids. And we have 2 very special guests with us this evening. First and foremost, we're going to go to one of the best infectious disease doctors right here in California. His name is Dr. Brewer. He's been with us from the very beginning of this pandemic. He's from the UCLA Geffen School of Medicine. Dr. Brewer is going to be giving us an overview of hospital ICU capacity, case rates, and hospitalizations with a special focus on the Bay Area and the North Coast. He's going to give us the latest on the Delta variant and how this variant is different from previous stages in the pandemic. He's going to talk about what is expected, or was it expected, I should say, was it expected that there's going to be breakthrough cases with vaccinated residents? And he's also going to focus on what we can expect on the variants and the potential surge in the months to come. And then, ladies and gentlemen, we are going to welcome for the first time, we're so grateful that he's here. His name is Dr. Morales. He's a Kaiser Permanente pediatrician. He's also a clinical professor at UCSF. Now, Dr. Morales is going to be telling us how the surge of the Delta variant is spreading among kids, and he's going to be talking about potential risks. He's also going to be talking with parents tonight, talking with parents about what they can do to keep their kids and teachers in the classroom safe. But the most important part of this evening, it's going to be hearing from each and every one of you. We want to hear your questions, your comments, your concerns. We want to hear your criticisms. If you're watching online right now, or if you're listening on the phone, please hit us up via email, senator.mcguire@senate.ca.gov. We're taking your questions live here this evening for our coronavirus town hall, senator.mcguire@senate.ca.gov. If you're watching us live on Facebook, good evening. Thank you so much for tuning in. You can simply drop your question or comment into the comment section, and we're going to get right to it. All right. Speaking of getting right into it, we're going to now turn it over to Dr. Brewer from UCLA Medicine. He's going to be giving us an overview on the coronavirus here in the Golden State, with a special focus of Northern California. Dr. Brewer, good evening. It's good to see you, sir. The floor is yours.
Thank you very much, Senator. And I'd like to start just by saying I share the frustration of everyone who's wondering, when is this pandemic going to end? So as the Senator mentioned, we're now about 18 months into this pandemic. And the important thing to remember is that viruses don't think. They don't care what our opinion is. They just replicate. And anytime we stop doing the steps we need to prevent replication, that virus is going to spread. And so just keep that in the back of the mind as we talk tonight. It's really not a matter of opinion. It's just a natural organism doing what it does. So where are we? In the United States right now, unfortunately, we're averaging about 130,000 new cases a day. To put that in perspective, in mid-June, we were about 11,000 to 12,000 new cases a day. So we're about 10 times higher than where we were even just a short 6 to 8 weeks ago. Fortunately, we're not at the peaks yet we saw back in January, but hopefully tonight we can share some information to stop that from going in that direction. We're having about 500 deaths a day, 550 deaths a day from COVID-19 across the country. And again, that's up from under 200 deaths a day back in the beginning of June to mid-June. Across the country, about 9.7% of people being tested are testing positive. That's a level. Hopefully that will start to come down soon, and maybe we can see some progress in this unfortunate upturn in COVID-19 that really started about 6 to 8 weeks ago. About 50% of the US population has been fully vaccinated so far, and we really need to get that closer to 80 to 90%. We'll talk about that. Here in California, we're averaging about 14,300 new cases a day, and our case rates are about 13 times higher what they were at the beginning of June. So as the Senator said, we've seen a big upsurge in California compared to where we were back at our lowest points. While our death rates haven't gone up as much, we've gone from averaging about 10 deaths a day to about 100 deaths a day. So again, a big jump there. We got to figure out how we can turn that around. We're doing a little bit better in California than the country as a whole. We've got about 64.7% of our population fully vaccinated. If we focus on the northern coast, and I'm going to give you some numbers for Alameda County, just because I had to pick one to start with. So Alameda is averaging about 330 new cases a day. And about 3 deaths. That's up from under 30 cases a day. So kind of matching what we're seeing as California as a whole. The test positivity in Alameda is a little lower. It's about 4.5%, but unfortunately it is still rising. So the trend is still going in the wrong direction. There are about 250 people hospitalized in Alameda County right now with COVID, up from 60 in mid-June when things were lower. And we have about 65 people in the ICUs there. There are about 88 ICU beds available in the county as a whole. If we look at Humboldt County and we look at vaccination rates by zip code, they range from 25% to 83%. So some parts doing very well, some parts not doing so well. So what about the Delta variant? So coronaviruses mutate, they change as they replicate. And if those changes create an advantage in the spread of the virus, it can establish what we call as a new variant. And the Delta variant first appeared in India around December of 2020. And what we know is this variant of the SARS-CoV-2 virus is about 2 times more transmissible than the Alpha variant, which was the previous dominant variant that spread across the United States back in the spring. So we're getting progressively more transmissible viruses. Unfortunately, there are some data to suggest that this variant may also be more deadly. So there's a study out of Ontario, Canada, to suggest that a 50% increased risk of hospitalization with infection with the Delta variant and a 50% increased risk of death. The good news is the vaccines still seem to be highly effective. So data published today by the CDC looking at New York State, looking at over 200,000 cases of COVID-19 from March through July, showed that the vaccines were still somewhere between 92 and 96% effective in preventing hospitalization and death, even with the Delta variant. So that's terrific news there. Unfortunately, the Delta variant accounts for about 98% of all cases in the United States and in California. So this is clearly the dominant variant. I know some of you are concerned about the Lambda variant. This has been around for several months, but it is not spreading like the Delta variant. Really, the Delta variant and the subdeltas are the only ones we need to worry about at this time. Some people have been wondering about breakthrough infections. Well, we always knew that the vaccines were not 100% effective, so we knew that there would be breakthrough infections. And there are some data from that same New York study to suggest that the ability of the vaccines to prevent infection does decline over time, so dropping from about 92% down to about 80% over a 6-month period, but still very good at preventing hospitalization and death. Can we expect variants to continue to emerge? Definitely, as long as transmission continues. And so the way to stop variants from emerging is to stop transmission. And the best way to do that is to get as many people vaccinated, both in the United States, but also around the world. We have to remember we're in a global pandemic to stop it for everybody. I'll stop there, Senator, and I'll look forward to answering any questions that the audience may have.
Thank you so much. That's Dr. Brewer from the UCLA Geffen School of Medicine. We are now 3,300 folks strong watching tonight's town hall. We welcome each and every one of you. Before we get to Dr. Morales, we want to say thank you to Norma and Katie and Lorraine and Nicholas, who are providing comments in our Facebook comment box. If you'd like to be able to ask a question, have a comment, please, if you're watching on Facebook, simply drop it right there in the comment box, number one. And then number two, if you have questions, you can also email us. Email us at senator.mcguire@senate.ca.gov, senator.mcguire@senate.ca.gov. All right, ladies and gentlemen, school is coming back into session, and we needed to be able to hear the perspective from Dr. Morales, a fantastic pediatrician with Kaiser Permanente, a clinical professor there at UCSF. He's going to be talking about the coronavirus in our kids. Dr. Morales, we welcome you to the town hall. Thank you so much for joining us. You have 5 minutes and the floor is yours, sir.
Thank you for your kind words, Senator. I'd like to say also that I have training with a master's in public health, and I've been able to work in the community with some nonprofits, and have seen really how hard everyone is working. And I wanted to acknowledge that this has been a long year and a half, and we've had lots of input from the media, and many in the community are working very, very hard. And I think all of us are feeling a little bit of what we sometimes call COVID fatigue. Uh, so with that in mind, I want to really talk about what are the realities that we're facing. There's some things that we can and some things that we can't change. A reality is that our kids are going back to school. Each county and each school district will have their different variation about what they're going to do with going back to school. And I leave that to the school districts. And the other reality is that the Delta is surging. And so what we see is a lot of worried families. Um, but at the same time, we need to get our school kids back to school. This past year, I've seen so many children with depression and anxiety, feeling lost because of the lack of structure in their life. There's been lost opportunities with education, and we need to get them with a good learning environment, good socialization, and really get them on with the future, their career. But I want you to remember, though, is that the surge is something that is really not because kids are going back to school, or not something that's going to be made worse by going to school. This really started because at the same time this summer that we were opening up the economy, we were putting less restrictions on mask mandates and things like this. All of us who had been pent up for so long started to do more, and going to Disney, crowds, family gatherings, whatever it is, that we started to see this uptick in the Delta variant. And when you have our kids going back to school, what we're going to see is some aspect of a combination of masks, social distancing, hygiene, and we're going to have structure within the school system that's going to keep our kids safe. So what are we seeing with the virus is that the Delta variant, as Dr. Brewer said, is something that's much more contagious, and there's evidence that it's showing that it's hitting our patients harder. What I'm seeing locally is that I'm seeing younger people being affected by this virus, meaning that in the beginning, we were talking about people over 65, people with comorbidities getting sick. And now I'm seeing in the hospital patients in their 30s, in their 40s, in their 20s. One of my patients last week was admitted at the age of 15 with symptoms of the virus. And these symptoms can be congestion, cough, sore throat. And the majority of children that are younger, and we're talking under 12, they may just have a runny nose for 2 days. They may have a slight fever. And some kids are having nausea, vomiting, a little bit of diarrhea, and they get through it. And so even though the symptoms are getting worse and hitting younger, our children that are school age are not at increased risk. And I want to underline that. The other thing I wanted to say is that what I'm seeing locally in the hospital are patients that are admitted have not gotten the vaccine. So when you get the vaccine, you're protecting yourself from getting critically ill. You're protecting yourself from going into the hospital, and possibly protecting yourself from death. Now, with that in mind, I talk to families every day, and I'm getting excellent questions. I have a lot of parents that have questions about what they hear on the media, and they ask good, clear questions. Tell me the difference between Pfizer and Moderna. Why is it Pfizer for kids and not Moderna? What kind of side effects? Are they worried about the risk of endocarditis? And when I go through the data and I go through the facts and I keep it objective and not emotional, I have to say many of those on the fence move to get their kids vaccinated. Because really the next step, if we're going to get through this, is that we need to get our kids vaccinated. Those over 12 that are eligible, there's no reason why they shouldn't get vaccinated. And if you're a family, you want to protect, you want to have this bubble of protection around your kids. So you get yourselves vaccinated to protect your family.
30 seconds.
And so we can talk more about the 5 to 11-year-old 0 to 4, but more importantly than anything, the Delta is the most prominent. Get vaccinated, and we really need to work together to protect the ones that we love and to get ourselves back to some kind of normalcy so that we're helping our schools help our kids. And that's how I look at it. So thank you, Senator and Dr. Brewer.
Thank you so much. That's Dr. Morales from Kaiser Permanente. He is a recognized pediatrician, does amazing work, and he's going to be answering your questions here this evening. So ladies and gentlemen, you have two experts that are with us today. You have Dr. Brewer, who is one of the top infectious disease physicians here in the state of California. He's with UCLA Medicine. We're taking your questions on Facebook. Simply drop your comment into the comment section. We're also taking your questions live here tonight via email. Email us right now, senator.mcguire@senate.ca.gov. We're taking your questions, your comments. We want to respond to your criticisms. Senator.mcguire@senate.ca.gov. Accurate, timely information here this evening on the Delta variant, sending our kids back to school and the coronavirus. Let's get right into it. Karen writes in, this is for Dr. Brewer. Dr. Brewer, Karen says, isn't the vaccine supposed to help me not get the virus? Why are there breakthrough cases?
Sure. So Karen, almost no vaccine is 100% effective. And in fact, the vaccines will reduce your risk of getting infection. Unfortunately, because the new Delta variant is so transmissible, that protection is lower than what we've seen with previous variants. However, that having been said, the vaccine was still 80% effective in preventing people from getting infection in a study in New York State with over 200,000 people that was just published today by the CDC. So it will protect you against getting infection, but not as much as previous variants.
And Dr. Brewer, I think that was expected all along. I think that there was some
Exactly.
right? So talk about that a little bit, because even if you get a vaccine for the flu, you may still get the flu, but not as serious. You want to talk about that?
Exactly. What the vaccines are really good at still, even with the Delta variant, are preventing hospitalization, serious disease, and death to the order of 92 to 96%. Now, if you're old enough, you'll remember the Salk vaccine for polio. The Salk vaccine actually did not prevent infection at all. 0% protection against infection, but what it did do is prevent disease. And so what we're seeing with the Delta variant is the vaccines are still very good at preventing against serious disease and some protection against infection, but not unexpected.
All right, that's Dr. Brewer. Dr. Brewer, we're going to stick with the issue of one being vaccinated. Then we're going to go to a question for Dr. Morales. Dr. Brewer, Betty writes in, if one is vaccinated, how contagious is a person if they acquire the Delta variant?
So Betty, we don't know for sure, but what we do know is that if you're vaccinated, your risk of getting infected if you're exposed to the virus is about 80% lower after 6 months after your vaccine, and about 90% lower if you're within 2 months of being fully vaccinated. If you do become infected, we also know that your level of virus seems to be lower and that you have shorter symptoms as well. So all of these are very good. And then, as I said, great protection against serious disease enough to put you in the hospital or potentially the ICU or even die.
All right, that's Dr. Brewer, and you are turned into our coronavirus town hall. We welcome each and every one of you. Thank you so much for joining us. We're taking your questions tonight at senator.mcguire senate.ca.gov. We're taking your questions on the coronavirus. We're taking your questions with Dr. Morales, who is a Kaiser pediatrician, all focused on kids. Let's get to our first question on our kids. Look, Dr. Morales, parents are rightfully concerned. They are worried about the health of their kids. Ariana writes in, is it safe to send my child to school? What is the infection rate that initiates concern for a parent? That's from Ariana, Dr. Morales.
Well, let's start off with the first part of the question. Yes, it's safe to go to school. The schools are doing everything possible to work in keeping your kids safe with the way the teachers are conducting classes, the way they're having hand washing, the mask rules inside versus outside the classroom. And the other thing too is that what happens with your kid at school really also starts with what's happening at home. What we're seeing is many families are choosing to vaccinate themselves and choosing to get their kids vaccinated in order to protect that bubble of protection around their kids. And in terms of whether or not a kid, what the school is going to say about what is too much, I think it really depends on the school district and the local public health office. I honestly think that we're going to be okay in the school environment.
So, Dr. Morales, there's been a lot of talk about kids and not seeing as serious form of the coronavirus as an adult. Is that
Right.
still true with the Delta variant?
It is true. However, in before, let's say 5, 6, 7 months ago, I might see a positive case with no symptoms. Now I'm seeing runny nose, sore throat, maybe 1 day of fever, and that's it. You have to understand that for the most part, this is 99% of kids. We do in our community have kids with cancer, kids who've had organ transplant or some very rare congenital disorders where they are higher at risk. And these are the more vulnerable children that we have to protect.
So, Dr. Morales, what you're saying is the vast majority of kids, if they contract the coronavirus, will have some type of symptom that is cold-like, flu-like.
Mm-hmm.
The vast minority of kids will contract a more serious strain. Is that correct?
Well, not a more serious strain, Senator.
Case, I should say a case. Sorry.
And you're right. And I think what we have to be careful about is generalizing. What I worry about just as much as our kids is the parents. You have a kid who has a very mild case. They come home, and if the parents are not vaccinated and one of them gets sick, you may see a 9 to 40 day hospitalization. What's that going to do for the person who's taking care of the family, the breadwinner, so to speak? How is that going to help the family structure? So it all goes together. Is you need the parents to support the kids, you need the families to support the school, and you need the kids to be in school to get ahead.
That's Dr. Morales, Kaiser Permanente pediatrician, clinical professor at UCSF. We're going to come back to talk about kids and COVID in just a few moments. We're going to go to Dr. Brewer. Dr. Brewer, we're going to talk about dancing for a second. Barbara writes in, can adults who have all been vaccinated with either Pfizer or Moderna dance safely indoors with masks on, large room with about 20 people for 2 hours? Very specific question. Dr. Brewer, dancing with fully vaccinated folks.
So Barbara, I'm not aware of any data, but I would say that that's the safest way to do it. So being vaccinated is the single most important thing you can do to protect yourself and those around you. Wearing a mask in addition, particularly in an indoor setting, is also very helpful, reduce the risk of spread by about 80 to 85%. If you can dance outside rather than inside, that will lower the risk even more. So what I would suggest is take advantage of the beautiful California weather and dance outside.
There we go. Dr. Brewer, UCLA Geffen School of Medicine. We're going to go to Bonnie. Bonnie writes in, and by the way, Dr. Brewer, a lot of folks are starting to hit the road, starting to travel after a year and a half. Bonnie and her husband are going to do the same. She says, my husband and I are both vaccinated, and we're planning to visit a friend in Maui who is not vaccinated. She doesn't believe in the vaccine. My husband and I feel relatively safe from the virus, but worry about her. What should we be concerned about? Maybe we don't visit her. What is your thought, Dr. Brewer, and especially with the holidays that will be here before you know it? Let's just be honest. There's going to be some family members vaccinated, some not. What's the rule people should follow if you have a vaccinated couple visiting an unvaccinated friend?
So no specific rules, but recognize that your unvaccinated friend is at higher risk for both becoming infected and, if they become infected, spreading that to you, even if you're vaccinated. However, the vaccine will protect you substantially. So what I would recommend is, if you go to see your unvaccinated friend, wear a mask, try to see them outdoors, and maintain at least a 6-foot distance from them. And if you do that, you'll substantially lower your risk if they are infected and are unaware of it.
Just the facts tonight, just the facts with two medical professionals, Dr. Brewer, Dr. Morales, on the coronavirus. One more before we go to Dr. Morales. This comes in from Larry on Facebook, Dr. Brewer. Larry says there were more deaths per day with the common flu than there was with so-called COVID. Now, I'm just going to be candid. That's BS. We know that. My words, not Dr. Brewer's. Dr. Brewer worked the COVID ward at UCLA. Let's dispel the myth that the coronavirus is just like the flu. Dr. Brewer, talk to us about that.
So Larry, in a typical year, we'll have somewhere between 20 and 40,000 deaths from influenza across the entire United States. In a really bad year, we might see 60,000 deaths from influenza. We've already had over 600,000 deaths in 18 months from the SARS-CoV-2 virus. So the number of deaths is over 10 times higher than what we would expect from even a bad influenza. We have not seen a level of death this high since 1918 from a respiratory virus. So this is clearly not a typical scenario that we would expect even from a bad influenza virus.
Just the facts tonight from Dr. Brewer. Let's go to Dr. Morales. Lillian writes in, Dr. Morales, how would getting the Delta variant affect a pregnant, fully vaccinated woman and the unborn baby? Dr. Morales.
Great question. The vaccinated mother will have built antibodies and protection that will also protect the unborn baby. So that means that you have the same level, 96, 98% protection that you would get from the vaccine for the mom is for the baby, for the unborn baby. So I would say that if she feels great, she has no symptoms, the baby's going to be fine. And that protection for the baby will last through the delivery, at least a few months. As the cord is cut and she's breastfeeding, that protection will continue. So I think for moms who are expecting, getting the vaccine is a great way to go.
Right.
Senator, if I can just add, we know that pregnant women are at increased risk for serious disease if they become infected with COVID-19. And I have taken care of pregnant women who have had to be on mechanical ventilators because they've had COVID-19. We also know that pregnant women who become infected are at increased risk for early delivery before 37 weeks. So critically important, if you're pregnant, to get vaccinated. It will protect you. It will protect your unborn child, as Dr. Morales said. And the CDC now recommends vaccines for all pregnant persons.
Yeah, and thank you, Dr. Brewer, because I've taken care of the babies of these moms and it's not fun. So
Thank you, Dr. Brewer, Dr. Morales. Dr. Morales, we're coming back to you. John writes in, why was there a cutoff of 12-year-olds for the vaccine? So what is significance of 12 and up who are recommended to get the vaccine and 11 and younger not to? What's the significance, Dr. Morales?
well, I don't want to speak for the CDC. I know with what we were doing within our Kaiser system, we started off with a study group that we knew we could handle, which was the 12 and up, the 12 to 18. And I know that it wasn't just Kaiser doing this. And you have to, it's always easy to go, well, I would say it's always easy to look in retrospect. But there are ongoing studies for the next group, which is the 5 to 11, which in the next 2 to 3 months should be approved. And then we're going to go down to the 0 to 4. So I think there's a stepwise, be careful, be safe, make sure it works approach to helping everyone. And we have to also look at the risk. The older you are, 12 to 100, is a higher risk right now that we're seeing from the 0 to 11. So I think that's a lot of the choices are being made.
We're now at 3,500 individuals watching. Thank you so much for tuning in tonight, either on the phone, Facebook, or online. We welcome you to our coronavirus town hall. We're taking your questions on the Delta variant. We're taking your questions on the coronavirus and how the coronavirus potentially impacts kids. One more question for Dr. Morales before we go back to Dr. Brewer. Alyssa writes in, I'm so sorry, Jamie writes in, are kids spreading COVID while outdoors at school? Are kids spreading COVID while outdoors on school? This is coming from Jamie off of Facebook. Dr. Morales.
Hi there, Jamie. That's assuming that a kid is positive. And the other thing too is we have to look at social distancing. If you have kids on a playground and they are following social distancing rules outside 6 feet or more apart, I doubt it. If you have a bunch of kids clumped up on the slide, no masks, and somebody's sick, that is a risk.
All right, please go ahead, Dr. Morales.
That's basically it. That's how I would say it for outside.
Thank you, Dr. Morales, Kaiser Permanente pediatrician, clinical professor. We're now going to go to one of the best infectious disease docs here in the state. That's Dr. Brewer. Dr. Brewer, we're going to go to Marie. Marie says that she has had Bell's palsy in the past, and her doc told her that more than once not to get vaccinated. Would like to be able to get your opinion on that. She also had GBS at 50, and she's now 77. So talk to us about those underlying conditions, previous health conditions, Dr. Brewer.
So what I would suggest is ask your doctor to refer you to an infectious disease specialist to talk about the different risks. So GBS is Guillain-Barré syndrome. It's a type of paralysis that has been associated with vaccines before. So for example, the swine flu vaccine in 1976. And there are reports associated particularly with the adenovirus vaccine. So that's the Johnson & Johnson vaccine in the United States, and that is the AstraZeneca vaccine in Europe. Those seem to occur somewhere on the order in about 2 to 11 cases per million vaccines, so very, very low. And they seem to be, for the most part, reversible. But because of that concern, I would say talk with a specialist. I am not aware of similar rates for the mRNA vaccines, Pfizer and Moderna, so it may be that that would be a good option for you. Remember, at 77, you're at higher risk for serious disease and hospitalization should you become infected with the COVID-19 virus. So I would recommend sitting down with a healthcare professional expert to try and get all these questions answered for you.
We're going to go to our next question, Dr. Brewer. We're getting a lot of questions about booster shots. Number one, if an individual got Pfizer, can they get a Moderna booster shot or vice versa? How are booster shots going to work? Talk us through it, Dr. Brewer.
Sure. So as you probably are aware, the CDC and the FDA today announced that they're probably going to be recommending booster shots for people who were vaccinated at least 8 months ago. They did not talk at all about mixing. What we know from data from Europe is if you mix AstraZeneca and Pfizer, you actually get a better immune response, but you also have more side effects in terms of more likely to have pain in the arm, fever, chills, and other symptoms. But combining the vaccines does seem to work. In terms of whether or not we need boosters, that's based on data to show that neutralizing antibodies, basically blood tests that seem to suggest protection against the virus, decline over time. And as I mentioned, studies like the one from New York just published today, suggesting that the risk of breakthrough infections, but not hospitalization and deaths, also increase over time from vaccination. So those are the data that are leading towards boosters. But I think we still need to wait for more information to come out for sure.
So, Dr. Brewer, we're in year 2 of the coronavirus here across the planet. Are we going to be getting coronavirus shots in another 2 years? What do you see as far as vaccinations, the need for vaccinations ongoing due to the coronavirus here in the United States?
Totally going to depend on how much we're able to stop transmission and prevent variants from emerging. So the reason why you might have to get a booster is because as the virus spreads, it changes, and if it changes enough, then the previous vaccine that you got may no longer be as effective against the newer variants that are now circulating in the community. And that's exactly what happens with influenza. That's why you have to get a flu shot every year. It's not that the influenza vaccine didn't protect you from the influenza virus before, it's that the influenza virus has changed while it's spreading around the world. So unless we can stop these variants from emerging, it is possible that we will need to continue to get booster shots over time for the COVID-19 virus.
So, Dr. Brewer, just being candid, right? I mean, we're probably going to have to be able to look at some type of vaccine shot in 2022. But you think eventually, based off of eventual herd immunity in the coming years or it burning out because of folks being vaccinated, that eventually we may not have to get the shot, but most likely in 2022, I would say, and I'm no medical professional, but looking into the crystal ball, we're still going to be getting that shot. Your gut?
So my gut feeling is we're actually never going to get rid of this virus. This virus is so transmissible from person to person that we won't be able to completely get rid of it. And we actually have 4 other coronaviruses that circulate all the time in humans. So this won't be the only coronavirus out there circulating. But hopefully what we'll do is we'll get to a point through vaccination that these viruses do not cause serious disease, that they cause mild disease that really does not impact on the individual or on society. So that's why getting vaccinated is so important, both to prevent these variants from emerging, but also to prevent the serious consequences if you do get infected.
We're taking your questions on the coronavirus, the Delta variant. We're taking questions about COVID and your kids tonight. Welcome to our coronavirus town hall, 3,500 folks strong. We welcome you. Thank you so much for tuning in. We have Dr. Morales, pediatrician from Kaiser. We have Dr. Brewer, an infectious disease physician from UCLA. We're going to get to a couple of questions about our kids in just a moment. We're going to stick with Dr. Brewer. Dr. Brewer, let's talk about masks. Diana writes in, I've been wearing a cloth mask since March of 2020. With the Delta strain, what mask is recommended? Dr. Brewer?
So Diana, any 3-ply mask is recommended by the CDC is very effective. So in terms of the level of the mask, so the highest level is something called an N95 respirator. That's what I wear in the hospital when I'm taking care of a patient with active COVID disease in the intensive care unit, for example. So that gives you the most protection, and that protection is around 98 to 99%. If you wear a typical hospital surgical mask, like the kind you see on television, then your protection level is somewhere around 94, 96%. So not that much different. If you wear the typical kind of cloth mask that you can buy in the stores nowadays, somewhere between 88 and 92% in terms of reducing the droplets that both come out and get in. Still very good. The one thing that's not particularly good are the bandanas. So in general, you don't want to be using the bandanas if you can use a more appropriate form-fitting mask. And the better the mask fits, the better it will protect you.
Thank you so much, Dr. Brewer. Dr. Brewer, UCLA Medicine. All right, we're gonna, I will say, Dr. Morales, a lot of questions coming in about women who are pregnant. So I want to hit this one more time if it works for you, Dr. Morales. So the recommendation for pregnant women and the vaccine is pregnant women should get the vaccine. Correct, Dr. Morales?
Correct. And Dr. Brewer can confirm that as well, but yes.
Correct, Dr. Brewer?
Definitely.
Okay. For the two of you, David asks, have there been any thorough studies on any potential side effects on the vaccine on fetuses? Dr. Brewer and then Dr. Morales.
So no data that I'm aware of at all. There have been studies that have been ongoing, and there's actually a vaccine registry to look at outcomes in pregnant women who have been vaccinated. I don't know if Dr. Morales is aware of any data, but I have not seen anything to suggest any risk to fetuses. And as I mentioned, there are actually good data to show that it both reduce the risk of preterm delivery and the risk of serious disease in the pregnant mom.
So I'd like to add to that, Dr. Brewer, is there can be sometimes a misconception when I talk with families about the difference between a live virus and a non-live virus. For example, like this mRNA virus, the vaccine. And giving a vaccine that is a live virus, for example, chickenpox may cause that virus to pass on. But if we're talking about COVID vaccine or the tetanus vaccine, we're not seeing that infection pass on, we're seeing the protection pass on. So the only side effect that I'm seeing, and I've had kids in my practice that have been born to moms who've received the COVID vaccine, I see that the side effect is a positive one, better protection.
Yes, Dr. Morales. Please, Dr. Brewer.
Yeah, no, you're exactly right, Dr. Morales. None of these vaccines have components that replicate. So they cannot replicate it all in the human body. That's true of the Johnson & Johnson vaccine, Moderna, and Pfizer. Very important point from Dr. Morales.
All right, let's talk about Moderna in kids. Jan writes in, Dr. Morales, why can't 13-year-olds get Moderna? Is it less safe? Dr. Morales.
I have not heard anything about safe or not safe, and that's a little bit out of my wheelhouse. I know that we've had emergency approval by the FDA to get kids 12 and up for the Pfizer. And that would be about an approval process that I do not have any background on.
I think
Dr. Brewer.
Yeah. So I think that the reason is actually just Moderna has not submitted data to the FDA in that population yet. So I don't think anybody has any concerns, but before the FDA can actually give an emergency use authorization, the company has to provide them with efficacy and safety data. And I don't think Moderna has done that yet for the population, but hopefully they will soon.
Yes, and Pfizer has done that.
That's exactly right. That's why Pfizer has and Moderna has not.
All right, let's go to a question from Michelle. It's more of a comment, and Dr. Brewer, I want you to comment on this. She knows people who got the vaccine, got COVID, and died. Now, let's just be candid about this. No vaccine on the face of this earth is 100% effective. But also, let's be blunt. The folks who got the vaccine when you compare it to the death rate of those who are unvaccinated, it's off the charts numbers wise of who are passing away from the virus. But let's hear from the professional, Dr. Brewer, about this comment.
So that's exactly right. So will the vaccine save everyone? Of course not. But your risk of serious hospitalization and death is reduced about 92 to 96%, even with the Delta variant. And that's data that was just published today, looking at over 212,000 patients in New York State between March and July of this very year. And if you look at the absolute death rates, they're about 1/10 or below, and your risk of hospitalization is 80 to 90% lower if you've been vaccinated. About 97% of all hospitalizations from COVID-19 right now in the country are occurring in unvaccinated individuals. So the vaccine, not 100% effective, but really darn good.
One more time, Dr. Brewer, talk to us about that 98% stat.
So one more time, about 97% of everyone in a hospital right now with COVID-19 disease was not vaccinated. Those vaccines reduce your risk, and that we've vaccinated over 160 million Americans. So a lot of people have gotten this vaccine. That vaccine will reduce your risk of hospitalization and death somewhere between 92 and 96%. So while it's not 100%, it's very good.
That's Dr. Brewer from UCLA Geffen School of Medicine. We're going to go to Dr. Morales. Dr. Morales, Kim writes in, the doctor spoke and said that kids were not at risk with the Delta variant. You said not as at risk than the Delta variant. And what Kim is pointing to is the news has had many stories about how pediatric beds, including the ICU in Texas, are full of kids very sick from COVID. So talk with us about that and with those stories coming out of Texas, please, Dr. Morales.
I'd also like to just remind everyone that some of these breakthrough cases with mortality, we have to understand that some patients, some people who got sick also have a lot of what we call comorbidities. Mm-hmm. So it may be that somebody has diabetes or is severely obese and they got the vaccine and they might be close to, an advanced age where sometimes there's just too much else going on. So we don't have the whole picture. And that's the whole thing about with pediatric ICUs is that the number of beds in an ICU are pound for pound compared to an adult ICU, where it's much smaller, so they fill up quicker. So we have kids in our community with cancer. They have congenital defects. They have organ transplants. And then there's things about what these kids have gone through in their cases that I don't have privilege of their medical record to know exactly why they ended up in the ICU. So what we have to look at is that there's much more to this picture, and we do have around us in our own community, potentially very vulnerable kids. And so when we think about California and we think about Santa Rosa, we think about what ICU space is for children, we need to think about that is that there's very few, the beds are a high commodity, can be very scarce. And we may have to, if in a case, send somebody to San Francisco, Oakland, San Jose, if we are not careful in vaccinating.
Thank you, Dr. Morales. Dr. Morales is Kaiser Permanente. We're taking your questions, your comments, your concerns here tonight. We welcome you to the conversation. Please email us, senator.mcguire@senate.ca.gov, senator.mcguire@senate.ca.gov. I will tell you, we are getting dozens of questions into the email on Facebook. We are so grateful for your participation. We are now going to be entering our lightning round of questioning for our two doctors. We're going to ask the doctors We have about 15 minutes left in our town hall. We're going to ask the doctors to be able to keep the responses, if it's okay, doctors, to about 30 seconds tops, just so we can get to as many questions as possible. All right, so let's go to our next question from Rodolfo. Rodolfo writes to you, Dr. Morales. Dr. Morales, what are the safeguards for kids with comorbidities? Should we offer them online classes? So if we have kids with underlying health conditions, what is your recommendation for those parents in sending them to school? Dr. Morales.
Well, I'm going to keep it quick. I'd say create the bubble, protect your kid, and work with the school district.
And what would be the safest way to approach this, would you say, with underlying health conditions?
Make sure the whole family, including extended family, are vaccinated. Make sure that you are leading by example with mask and wearing and social distancing, and work with your school. Talk to the school about your special situation.
Craig writes in. Craig says, should mothers breastfeed babies to help immunity for those babies in the system? So I guess that would assume a mother has the shot. Can a child receive antibodies through that breast milk if they are feeding, Dr. Morales?
Breast milk, we always go with the idea breastfeeding is best. Not every mother is capable of breastfeeding. So I want to acknowledge that it's not okay for everyone, or not possible for everyone. With that in mind, it will provide protection on the oral mucosa and the nose area, and that's how the COVID is infective. So it helps. But also mom washing her hand, mom wearing a mask, mom being careful in social situations is equally protective.
That's Dr. Morales from Kaiser. We're now going to go to Dr. Brewer from UCLA. Dr. Brewer, David and Lynn writes in, what makes the Delta variant more contagious? Dr. Brewer.
So, David, the Delta variant has changes in the spike protein, which is part of the virus that binds to the cell receptor to get into the human cell. So there are mutations there that allow it to bind more tightly and more efficiently than previous variants.
And give us your thought, Dr. Brewer. Do we see additional mutations of the Delta variant? Is there a possibility this is going to become even more infectious than it is now?
So that's actually already happened. There are actually 3 subtypes of the Delta variant that are circulating in addition to the parent variant. And as this virus continues to be transmitted, there are opportunities for it to continue to mutate. That's why vaccinating and stopping transmission is so important.
We're going to go to William. William writes to Dr. Brewer, and he asks, what are the projections for the next 2 months, given the rapid spread we are now seeing? Dr. Brewer.
So hard to know, William. But unfortunately, right now in the country as a whole, we're seeing rising cases, though that's actually being driven by 4 states in particular that have particularly low vaccination rates. In California, we've been going up since the beginning of June, but the last few days, it looks like it may be leveling off, and test positivity actually dropped for a couple of days. So hopefully in California, we're starting to turn the corner.
Dr. Brewer, Allison writes in, how accurate are home COVID test kits? Are they worth keeping on hand in case of exposure?
So probably not good for exposure. Where they're more likely to be accurate is when people have disease, because the viral loads will be higher. If you're really worried about an exposure, you should go see your healthcare provider or contact your county public health department.
Dana writes in via email at senator.mcguire@senate.ca.gov. Dana writes in, once people do get infected, is there anything known about what would minimize the chances of long COVID? So Dr. Brewer, take a little bit of time on this. Describe long COVID, and is there anything known about how to minimize the chances of long COVID? Dr. Brewer.
So the best way to prevent long COVID is to prevent infection. If you do get infected, your risk of of getting long COVID is somewhere between 30 and 80%, depending on the particular study. And that can manifest as things like what's called brain fog, just trouble concentrating. It can be muscle aches or myalgias. It can be fatigue. We tend to see it more likely in people who've had serious disease, particularly people who've had to be either in the hospital or in the intensive care unit. But it can occur even in individuals who've been asymptomatic, infected, but didn't have any symptoms.
We are doing a lightning round of questions for our two doctors. Dr. Brewer, coming in from Sybil. Sybil asks, Dr. Brewer, I'm looking for clear guidance / advice for essential workers who are vaccinated, safely working in a small shared office, 4 people in a 1,500 square foot space with cubicles. Now, Dr. Brewer, your thought, is that safe for vaccinated folks?
So if they're all vaccinated, then the current recommendation is you do not need to wear a mask. If you are concerned, wearing a mask will reduce the risk lower, but it's already very low to begin with. So you don't have to wear a mask. Other things you can do is try to improve the ventilation. If you have a window in there and the weather allows for it, opening the window and improving ventilation will also help.
Dr. Brewer, what vaccine is better, Moderna, Pfizer, or J&J to combat the Delta?
So right now, there are some data to suggest that Moderna is a little better in preventing infection than Pfizer or J&J, but they're all pretty comparable, particularly Pfizer and Moderna, in preventing serious disease and hospitalization. So the single most important thing is to get vaccinated rather than to worry about the particular vaccine.
Dr. Morales, coming back to you, Robert writes in, how do I keep my kids safe at school? Where do you think the most likely place for transition will be? Would you say cafeteria? Would you say in the classroom? Where would you want enhanced attention for kids to make sure that they eliminate their risk for COVID?
I think the biggest risk would be their own kids or anyone's kids' compliance with using a mask. If you have a kid who goes into school and then takes off their mask or does the old chin mask where they're not really doing anything, and those kids are walking around and they're going to get COVID. If they follow the guidelines and they work with the school and they listen to the teacher, they're going to be safe. There's going to be guidelines. I know the school's working on this with guidelines related to what happens in the lunchroom, what happens on the playground, and what happens in the classroom. There's hand sanitizing going into class. There's hand sanitizing going out of class. There's all kinds of regulations. It's a matter of the kids following the rules.
Dr. Morales, we're going to go to LaTanya. Would you agree, Dr. Morales, that students that contract the coronavirus may have an existing precondition such as the flu, common cold, or an illness that lowers the immune system's natural defense?
We're all exposed to different kinds of things every day, and we can handle more than one quote insult at a time. I don't think it's going to lower our immune system. However, if we're not sleeping well, we're not eating well, we're not exercising, our weight is up, all those things are going to affect how easily we get infected with things.
And the same could be said for kids.
Yes.
All right. Thank you so much, Dr. Morales. Let's go to Dr. Brewer. Dr. Brewer, we're going to go rapid form here. Betsy writes in, as a senior, I'd like to hear about the safety and dangers of travel, being indoors with a group. Her brother's long delayed memorial is in September. So what would your advice be to Betsy for traveling long distance on a plane to be able to go to her brother's memorial in September?
So Betsy, make sure you're vaccinated. Don't go until you've been fully vaccinated. When you're in public indoor spaces, such as the airport or the plane, make sure you're wearing your mask. Wash your hands, good hand hygiene after you get off the plane and after you've been in public spaces. Don't travel if you've been sick. And if you stick to that and try and keep your physical distancing in the airport and other public indoor situations, that will be the best protection possible.
Lina writes in for Dr. Brewer, I am fully vaccinated, but I'm nervous to fly to Atlanta here in the next couple of weeks. First time on a plane in over a year. Dr. Brewer, would you get on a plane if you're Lina? And what should you do to be able to protect yourself if you have to fly for business?
So Lina, I actually just got off a plane on Monday, and it was my second trip in 18 months, and I normal travel on a plane multiple times every month. The risk of transmission on planes, as best we can tell, extremely low, as long as everybody is compliant with wearing their masks, and the airlines are very good about that. When you're in the airport, make sure you're keeping your physical distancing from other people. Make sure you wash your hands before and after you get on the plane and after you leave the airport.
Dr. Brewer, Jan writes in, which vaccines have the highest risk for breakthrough cases?
So right now, the risk of breakthrough cases are a little higher with the Johnson & Johnson versus Pfizer and Moderna. Some data from Israel to suggest that Pfizer has a higher breakthrough infection rate than Moderna. But as I mentioned, they're all very effective in preventing serious disease, hospitalization, and death.
Kim writes in, Dr. Brewer, what can I say to family members who won't get vaccinated because they think it isn't safe? We're going to have Dr. Morales chime in on that as well. Dr. Brewer, again, this is going to be a conflict. We know it is a conflict. What can Kim say to family members who won't get vaccinated because they think the vaccination, the shot isn't safe? Dr. Brewer, then Dr. Morales.
So the most important thing, Kim, is to try to convince your family members to go talk with a healthcare provider that they trust and get answers to their questions and concerns. As I said, this vaccine has been given to over 160 million people in the United States and over 1 billion people around the world. They're very safe vaccines. The risk of serious side effects from these vaccines occur on the order of 2 to 10 per million doses of vaccine. To put that in perspective, if you get COVID-19, your risk of serious disease is about 15%. Your risk of ending up in the intensive care unit is about 5%, and your risk of dying is about 1%. So log orders higher. If you get disease, then side effects from the vaccine, most of which are reversible.
Thank you, Dr. Berg. Dr. Morales.
Thank you, Senator. I have this conversation every day. I spoke with a teenager today who was concerned that she heard on the internet that if she got the vaccine, she would become infertile. And I think the most important thing is to remember is that you have to go to the people that work with this every day and that you've built trust with. If the care providers are getting the vaccine and you're going to get your care, it's going to be, these are the kind of questions you want to ask is, I heard on the internet, there's this, I heard there's that, I've heard the other. And we would be happy to sit down with you and discuss it and show you how safe these vaccines are and describe why something about that rumor may not be true. You'll be very surprised how many people, after learning these facts, have gone on to get vaccinated and they've been just fine.
And that's why we're doing this tonight. This is our 16th coronavirus town hall here from the very beginning. And it is absolutely critical that we present the facts. I know that some may not agree, but the fact is this: vaccines are safe, they're abundant, they're free, and we have to be able to get out of this challenge time that we're in. The surge that we're seeing is among the unvaccinated, and it's completely avoidable. Tonight's forum is not about politics. It's about keeping our community healthy and doing the right thing for our family and to be able to help our health system thrive. So let's go to our next question. Comes from Marty. Marty asks Dr. Brewer, for someone who was fully vaccinated, but who later tested positive for COVID, Marty had a mild case, they say, does that extend or strengthen immunity? Dr. Brewer.
So Marty, it probably does actually boost your immunity. Important thing to remember is if you test positive, even if you've been vaccinated, you still need to isolate for those 10 days until you're all, or your symptoms are all better. but that vaccine may have protected you from getting serious disease and will likely boost your immune response to the virus.
We are taking your questions, your comments, and candidly, we want to hear from you if you have concerns and criticisms. So let's go to one of those criticisms now. David writes, "Why do you keep lying to us, McGuire? Please stop spreading unnecessary fear and panic about a virus that has over a 99% survival rate with little to no symptoms. You Democratic politicians are acting just like the fascists you accuse Trump and his supporters of being. Be brave, walk away from your positions, and stop pushing unjust laws and mandates on the public." And David goes on to say thank you. But Dr. Brewer, let's respond to David. Look, there are a lot of folks who think like David, and that says this really is nothing more than the flu, that this is simply not true. These are lies. Dr. Brewer, what's your response to that? And let's go to Dr. Morales. Dr. Brewer.
So, David, I think there are two components to your concern. The first is you're feeling like you're being forced to be vaccinated. And I suspect you've already received a number of vaccines. You've probably got measles, mumps, rubella if you went to public school, because you can't go to public school without it. You probably had a tetanus vaccine. So it's probably that you're not against getting vaccinated per se, but I also suspect you're feeling incredibly frustrated about how this pandemic has impacted your life and the lives of those you care about. And we all share that frustration. But unfortunately, we still have the virus in our communities, and we have to stop this transmission and protect ourselves and protect others. And in terms of the numbers, they're just real, David. 630 million deaths in the United States alone.
630,000.
630,000. I'm sorry. You're right, Senator. That was a mistake on my part. And that's log orders higher than what we would ever see with a typical influenza. And I can tell you, having taken care of patients in the intensive care unit, having had to watch patients die alone, because particularly at the beginning of the pandemic, we did not allow them to have visitors. This is a very real disease.
Dr. Timothy Brewer from UCLA Geffen School of Medicine. We're now going to go to Dr. Jose Morales from Kaiser Permanente. Talk to us. There's a lot of folks like David that have concerns and hesitancy. Dr. Morales, what's your comment?
David, I would just say, thank you for expressing your frustrations. I feel many times enough is enough, and frustrated about how long this is going on. I wouldn't choose the same kind of wording, but I understand what's being said in between the lines. What I'd like to remind David and those who are thinking on those lines is, as hard as it is to hear, this is one of those times in our lives in the world where it's not about me. We have to think about vaccines work best when we have herd immunity. And herd immunity means that as many people in a community, it could be your city, it could be a school, it could be your job, are vaccinated so that it doesn't spread. The virus doesn't spread. So on these dark times when the going gets tough, I would say consider a paradigm shift and look at this as it's about us. It's about us getting back to what we had before this all started.
That's Dr. Morales. Thank you so much, Dr. Morales. We're going to stick with Dr. Morales. We have just a few more minutes. Dr. Morales from Kaiser Permanente. This comes in from Catherine. Catherine asks, will infants and kids under 5 be more vulnerable due to the fires and smoke?
I think all of us have that risk, especially if we have upper respiratory symptoms. It's not just infants and kids. Whether or not it's going to increase our susceptibility to COVID, I would look at, do we have more flu? Do we have more colds in general? Any other viruses related to this? And I would say we're not getting more infections, but we're getting more upper respiratory asthma-like symptoms. Wear a mask for that.
Yeah, no, thank you, Dr. Morales. Dr. Brewer, there's been some studies about wildfire smoke in COVID and making folks more susceptible to COVID spread. Much of Northern California tonight is socked in by devastating wildfire smoke from these horrible fires that are impacting so communities to the north and east of us. We had a horrible fire, the Cache Fire in Clear Lake today. Talk to us about the link between wildfire and COVID spread, Dr. Brewer.
So, as Dr. Morales said, anything that damages the upper airways and the protective mechanisms of the body can increase your risk of infection, including respiratory viral infections. So, wearing a mask to reduce the risk of inhaling smoke and particles into your nose, mouth, and upper airways will help to reduce not only the risk from COVID-19, but other infections as well, because that smoke and those particles are actually toxic to some of the defensive mechanisms of our body that allow viruses to get in.
So your recommendation, especially for folks with pre-existing conditions,
stay indoors. So if you have pre-existing heart and lung disease, when the air quality is poor, definitely stay indoors where you have air conditioning, preferably HEPA filtered air conditioning if possible.
Ryan writes in tonight about flu shots and COVID shots. Number one, two-part question, Dr. Brewer. Should I get both a flu shot and my booster shot? Number two, is there any concern about a bad reaction if I get both shots? Dr. Brewer.
So Ryan, yes, definitely get both shots. I will too. Influenza is a different virus. And while it's not as serious as the COVID-19 virus, influenza can cause serious disease as well. So anyone over the age of 6 months should get their influenza vaccine every year unless they have a contraindication. Since the influenza vaccine will not protect you against COVID-19, still need your COVID-19 vaccine. Since your COVID-19 vaccine will not protect you against influenza, still need your influenza vaccine.
We're in the home stretch. 3 more questions. A lot of questions on travel coming in today. I think we know folks have been itching to travel. This comes in from Debbie. Should I wear an N95 mask while at the airport and on the plane? What would be your advice, Dr. Brewer? Dr. Brewer, just tell us. I think you said that you were on a plane. Did you wear an N95? Do you recommend N95 or is it traditional?
Yeah, so Debbie, I did not wear an N95 mask. I did wear a typical surgical mask. And as I said, the level of protection is about a 4% difference. It drops from about blocking 98 to 99% of those respiratory droplets to about blocking 94 to 96%. If you can wear an N95 respirator, it will give you a higher level of protection, but having had to wear them many times in the hospital over the years, they are uncomfortable, and you may find that it's difficult to wear them for particularly an extended flight. A good surgical mask or a well-fitted cloth mask will give you a very good level of protection, maybe a little more comfortable.
All right, last question for Dr. Brewer here tonight, and we're going to go to one last question to Dr. Morales. Victoria writes in, Dr. Brewer, please talk about natural immunity for those who have had COVID. What say you, Dr. Brewer?
So natural immunity definitely exists. The risk of infection is lower if you've already been infected with COVID-19. That having been said, the level of neutralizing antibodies in people who've been naturally infected are lower than the level of neutralizing antibodies in vaccinated individuals. But the good news is, if you get vaccinated on top of having been previously infected, we see very good immune responses. So as long as you're asymptomatic, 90 days out from your COVID-19 infection, definitely go and get vaccinated if you have not already been so.
That's Dr. Brewer, Dr. Timothy Brewer, one of the best infectious disease docs that we have in the Golden State. working the COVID wards in the good city of Los Angeles. And he has been amazing to work with here in Northern California, getting the facts out on this virus, making sure that folks have the tools they need to keep themselves, their families safe. Dr. Brewer, we're going to hear a closing statement for him in just a moment. Last question for Dr. Morales, who's just a recognized pediatrician here in Northern California within the Kaiser Permanente Medical Group. Dr. Morales, thank you so much. Also a clinical professor at UCSF. Dr. Morales, Matt asks, how old should my kid be to wear a mask? So what is your recommendation about kids wearing masks? There's a lot of comments about this tonight coming in via email. How old should kids be to wear a mask? Coming in from Matt, Dr. Morales.
Matt, that's a great question. I see kids under 2 in my office wearing masks and doing a great job. Some of it has to do with how the parents model it. If you are always going out and having masks, you teach them how to use the mask, it can go early. I think as soon as they're out and about and starting to touch things, then they touch their nose, they touch their mouth, there's a chance of getting infected. So the mask will also keep their hands out of their mouth. You may just need to, for example, if your kid's old enough to go to preschool, they're old enough to wear a mask. That's how I'd look at it, is if they're old enough to be out in public, you can try, but the younger, the better.
All right, Dr. Morales, Kaiser Permanente. Thank you so much, Dr. Morales. We're going to hear for quick closing comment from the doctor in just a second. Dr. Brewer, 30 seconds, closing comments, sir.
So I appreciate this has been a very long, hard 18 months, and we're all tired of this pandemic and this virus. But as Dr. Morales said, we're all in this together, and we just need to look past our frustration and our anger and ask, how can we continue to help each other to get through this? And if we can work together, get vaccinated, do the things that we know prevent the transmission of virus, it will get better.
Dr. Brewer from UCLA Medicine, thank you so much for joining us tonight. We're really grateful for your work, sir. Dr. Morales, closing comment, please.
Thank you, Senator. I have 3 words: vaccine, mask, community. And if we can keep those 3 words together, then we're going to get through this a lot faster. And thank you all for all your questions and your concerns, and any negative comments, positive comments, they're all helpful. And let's get through this quickly so we can all get back to what we like to do the best.
Thank you so much, Dr. Morales, pediatrician, clinical professor at UCSF. We're really grateful that you joined us. And ladies and gentlemen, I just want to say thank you. Thank you for being with us tonight. We literally received nearly 1,000 questions via email, online, and on social media. Thank you so much for your sincere collaborative engagement here tonight. I want to end it right here and say this. The thing is this: the only fight that we have as a community, the only fight is with the virus, not with each other. We're in this together. This is all about public health, not about politics. The best way out of this pandemic is by getting the shot. Vaccines are safe, they're abundant, and they're always free. To be able to get your shot, go to myturn.ca.gov. myturn.ca.gov. You will be able to find a free clinic near you to be able to get your safe vaccine shot. Again, ladies and gentlemen, we are so appreciative of your engagement here tonight. Thank you for this opportunity to be able to work with you in the State Senate. I also want to say thank you so much to Adriana, Carrie, Rebecca, and Sophia for all their work behind the scenes. We also need to say thank you so much to our director here tonight, John. Thank you for all of your efforts. We so appreciate working with you. Ladies and gentlemen, wherever you are, stay strong and good night. Thank you so much.
Good night.
Goodbye.